And also, I think the consideration that was specifically successful in this population means in clinical practice that we have the option of doing this after a topical corticosteroid, before a topical corticosteroid, basically on all the cutaneous surfaces of the body, so we won't necessarily be needing to split scripts for delicate areas compared to non-delicate areas. And the consideration of using it till it comes under control and then as needed afterward, because we have both a 4-week Q-day, which pretty efficient, Q-day application, and then up to a 1 year as needed study, to make us comfortable that both from the safety and efficacy standpoint, we can use it. So in clinical practice, I think the difference between real life and clinical studies is clinical studies, the drug studied as compared to vehicle. In real life is like, when do we want to bring this to our patients? And I think that our patients will have these regular discussions about topical steroids versus non-steroids. And the safe, appropriate use of non-steroids is a different conversation because you don't necessarily have the restrictions of the duration of use. There's no restriction in terms of quantity use or of the body surface area covered with this product. So that makes us comfortable explaining it in that way, and then we'll figure out in clinical practice where it is that we still use our topical corticosteroids or other non-steroids versus this product.